Hello, I'm Dr. Aaditya Kashikar. I'm consultant spine surgeon working with VR Spine Group. Today we are going to talk about the topic back pain, which is a very common topic in general population. How seriously one should take back pain? I feel, see, back pain is very subjective phenomenon because the pain threshold can be different or it will vary from person to person. Or the frequency of that back pain is getting more and more. For example, if one used to get back pain earlier once in 6 months, but if it's coming down once in 2 3 months, once in a month, so definitely something is going wrong and one has to be attentive. One more thing is, if at all back pain is not only restricted to back, but if it's going down in your buttocks or legs, like radiating pain or shooting pain in the leg, then that is also one alarming sign. So all these symptoms one has to keep in mind and be very attentive to your symptoms. So body only will indicate you whether you have to take these things to your doctor or not. So at what stage one should think of going to spine surgeon for their back pain issues? I would like to categorize this answer in age-wise manner. I feel whenever any child tells you about back pain, one has to be very much careful, and their parents should take their child to spine specialist immediately, because 80% of times this can be a pathological one. It can be infection, tumor, anything, because usually in pediatric population you don't get backaches. The second age group, the middle age group, what we common come across, most of them are involved in some or other kind of desk job, if at all. Then these guys are very much prone for prolonged sitting related issues. So they get these backaches, but again, if that back pain is getting more severity wise, frequency wise, so these are the stages where they have to take these things seriously and think of going to spine surgeon. The third population, the elderly geriatric population, at this age, the extensive degenerative age related uh, changes are seen, and that causes nerve compression, and these nerves are coming down in your legs. So most of the times this population comes up with issues of back pain with radiating pain down their legs. They feel discomfort if they walk for a certain time, and they typically say that after 5 10 minutes of walk they feel numbness, weakness, or heaviness in their legs. Is every back pain is related with spine? Not necessarily every back pain is related with spine, because there are certain other organs also which are located in the vicinity of the spine. For example, kidney, which is just situated adjacent on either side of the spine. So if patient is having any kidney stone, let's say, many times these patients, they complain of back pain, and especially they come with symptoms of difficulty in micturition, and while passing urine they feel what we in medical term typically call it loin to groin pain. Means that pain starts from their low back and it radiates in their groin, whichever side the stone is. So that is a typical symptom they come up with. So in this particular case or scenario, the renal or kidney stone patient also can complain of back pain. There are conditions like herpes zoster, which is a skin viral infection. Many times patients come to us just like any slip disc like symptoms, like severe back pain radiating down their leg. On examination, we don't see any positive finding, but later on, after 2 3 days, they just come up and tell us that they have seen small pustules or small rashes on their back skin or in hip or thigh region. So these are typical of herpes viral skin infection. So it can mimic a spine related issue, but not necessarily it is related with spine. So like that, one more condition, like there are intestines in the vicinity of spine. So if you have any issues with your intestine, then also one can have back pain. So depending on the allied symptoms what patient is having apart from back pain, one has to be more cautious or attentive to, and accordingly you have to clinically suspect that and ask for investigations accordingly, just to rule out any spine related or any organ related issue. If someone is getting back pain and if that person avoids going to any doctor, does that cause any problem for that person in future? If at all, if it's on lower scale earlier and gradually if it's increasing, or suddenly it increases and still that person ignores that fact that he is getting severe back pain compared to the earlier less severe back pain, then he is causing harm to his back because something grossly has happened within his back, and he is negligent on that fact, and he can land up with issues like if at all really if at all any nerve compression is happening inside, and if, as we all know that those nerves are also are going down the legs, he may develop with weakness in his legs, or he may develop some gallbladder issues. So severity of pain one has to be very much attentive to. ADL, activities of daily living, if these ADL activities are getting affected and still that person ignores this fact that it's getting affected, then definitely he may land up with some major issue uh, related with back pain. Third thing I would like to highlight is if patient is having back pain along with constitutional symptoms, what we call as if fever, weight loss, loss of appetite, and still he ignores that, because many times these constitutional symptoms are associated with tumorous like conditions. So again, this ignorance can cause major issues for that patient. He may develop increase in that tumor pathology in his spine or somewhere else in the body, and he can land up with severe acute nerve compression leading to paralysis of legs or gallbladder issues. So as and when any person comes across these three aspects of severity of his pain, frequency of his pain, along with associated constitutional symptoms, he has to take proper measures and he has to go to his nearby spine surgeon. So my advice for back pain is be attentive to your body symptoms. Body tells you the proper signals about your back pain. Take it seriously, because of our sedentary lifestyle, even the obesity is on rise. So never allow weight to increase, because that puts more pressure on your back and that contributes to your back pain. And be involved in good, at least 3 or 4 times a week, any kind of exercise activity which suits you better, and eat rightly so that you can lead back pain free life in future.